On top of the capsule and connecting the bones of your spine, you have some tough ligamentous tissue, which actually is called ligaments. And the ligaments hold the bones together. On top of the ligaments, you have something that you're all familiar with, but maybe not too much about, and that's the muscles. Muscles move bones. They move joints. My bicep muscle is here for only one reason, and that is to move my arm up at the elbow joint. You literally have hundreds of muscles in your body, many of which are in your spine, that allow your body to move these little joints in a variety of ways. Right? Now, if you remember correctly, I mentioned to you a few minutes ago that there are two things that happen when a joint doesn't move as it should. And now I'm going to tell you what the first one is. When a joint doesn't move as it should, the tissue that surrounds the joint swells. It has to happen. It's a physiological law that the tissue swells. The capsule, the ligament, and the muscle and other connective tissue swells. And it's the swelling that irritates the nerve. Most times, it's the swelling that's irritating the nerve, not a bone pinching the nerve. All right? It's the tissue not functioning, swelling, pinching on the nerve. When the joint swells, it irritates the nerve, and that nerve goes to a muscle. The muscle then goes into spasm. The spasming then immobilizes the joint even more, which causes even more swelling, which causes even less movement, more nerve compression, and we've got a cycle that's going around and around and around. And my job as your doctor of chiropractic is to break that cycle in as many ways as I possibly can. Number one, by using my hands, training, and experience to adjust the spine to restore the normal movement, by the use of the physical therapies in this physiotherapy department, such things as interferential, diathermy, intersegmental traction, ultrasound, the use of proper nutrition, and also the use of proper exercise. Why is it so important that this function as it should? The reason it is because these nerves, as you see on this model, don't stop like you see on the model. They go someplace. And they form two systems that you need to know more about. First of all, they form what's called the peripheral nervous system. And this is a system that that you use to control the movements in your body, but also allows you to determine, hey, there's something wrong with my body. Something is causing me pain. This system is so complex it defies description. If we took Daryl there and removed all of his non-nervous tissue, we still see him sitting there. He has over 1,300 nerve endings in each square inch of skin alone. We have nerves in our body that can transmit over 1,000 impulses an hour, at 1,000 impulses a second at over 200 miles an hour. In fact, when I was in graduate school, we spent an entire year dissecting cadavers, human bodies. And of that year, 4 months of it was on this nervous system. That's how complex it all is. But that's just part of the nervous system. Because right about here, inside your bodies, there's a branching. And one branch goes to form the peripheral nervous system. The other branch forms this system, which is called the autonomic nervous system. And this is the system that controls the organ systems and, along with the hormonal system, determines your longevity and quality of life on this planet. If I were having low back pain, like many of you are having, I'd be concerned that there is pain in my back and there's muscle spasming and there may even be pain radiating down your leg because the sciatic nerve is being irritated. But what I'd really be interested in knowing is there's a relationship there with my organs of elimination and reproductive organs. Those are rather important places, wouldn't you say, Carlos? Darn right. If I were having mid-back pain, I'd be really interested to know that there's a relationship here with my organs, the organs that allow me to digest and utilize the food that I eat. You see, there's this misunderstanding. People think that you are what you eat. That's not true. You are what your body can utilize and absorb. I could put a garden worth of food inside my body, but if it can't be turned into energy in the liver and the other organ systems and put it to work at the cellular level, Well, you're not getting adequate nutrition. There's 100 trillion cells inside your body, and every one of them needs to be nourished every single day. If I were having upper back discomfort, like some of you are having, I'd be really interested to know there's a relationship there with my heart and my respiratory system. Now, I'm not trying to say, Luis, that if you pinch that nerve, you drop dead of a heart attack tomorrow. You know, I'm not trying to say that at all. But what I'm trying to make you think about is what happens if there's a relationship with a nerve, and that nerve goes to an area that over a period of time, maybe years, maybe decades, could be affected. Could it not affect the organ system that it innervates? If that makes sense to you, go up and down like this, because that's the reason why I'm treating every single one of you. If I were treating your pain, I'd recommend blue pills, green pills, yellow pills, orange pills. They do a great job of covering up pain while those drugs are circulating in your body. I consider myself a cause doctor. And by that, I want to find out what is the underlying cause that's making this person manifest pain, and what can I do to help that person become strong? Why this is so important to you is something that could be demonstrated by the use of some pennies. And I'm going to pass some pennies out. And you just pass them down to each person, please. Okay, I want everybody to put your penny on the back of your hand, please. You know, we could probably carry on a conversation here, Karen, for years, and we wouldn't say to each other, gosh, this is really getting heavy, let's stop doing this, you know. That penny is not too heavy. But you know what? That amount of pressure that you're feeling on the back of your hand right now on one of these nerve roots is sufficient to alter the flow of nerve impulses along that nerve root. That's less than 10 millimeters of mercury of pressure is sufficient to alter the flow of nerve impulses along the nerve root as it exits that foramen. So we're talking about very small amounts of pressure capable of creating some tremendous health situations in your body, and most people aren't even aware of it. Right? So that's the first thing that happens when a joint doesn't move as it should. The tissue swells and irritates a nerve. The second thing that happens, and I promised you there were two, is that when a joint doesn't move, it begins to deteriorate. In the human body, in our society, we call this deterioration osteoarthritis or just plain arthritis. Because we see arthritis in so many of our senior citizens, we are led to believe that arthritis is just normal aging. In fact, you have people telling you that. It's not so. Just like all the teeth in your mouth are designed to last a whole lot longer than you and I live today if we take care of them, and you never have to lose a single tooth if you know how to take care of them, and you do.